Good evening and welcome everyone to this evening's webinar from Harley Street Fertility Clinic. The topic for this evening's talks are egg freezing. And first, I would like to introduce you to our panel. So joining us this evening, we have Dr. Geeta Venkat, who's the director of Harley Street Fertility Clinic, and Samantha Knight, who is our embryology lab manager. So we're very privileged to have two very experienced speakers. And this evening's agenda, so first we'll have some presentations that will cover the fertility checkup and sort of thinking about your fertility and egg freezing, and then the technical sort of bits and pieces on egg freezing, including some frequently asked questions, and then the practical aspects of egg freezing, including the pathway that one might go through. And this event will be recorded and uploaded on our website in due course if you want to return to it later, if you've forgotten something. We'll have a Q&A session, a question and answer session at the end. So please feel free to raise your hand, or you can submit questions via the Q&A panel on the Zoom platform. If you want to stay anonymous, that's absolutely fine. There's no need to say your name and your camera can remain off. So without further ado, I'd like to hand over to Dr. Venkat to get this started. Thank you.
Hello, thank you, Subir. Good evening, ladies and gentlemen. Thank you for joining us this evening. So this egg freezing is a very important topic. It is like planning your life and planning for the future. This is an important one. First of all, to do that, we need to know where we stand as far as fertility is concerned. That's why it's important to have a checkup first. That is, how many eggs do we have? What's the ovarian reserve? And how are things structurally, ovaries and the uterus? And should we act now, or can we leave it for a few more years? That is the question in everyone's mind. And sometimes life is so busy, people don't even have time to think about all these things, and they leave it late and then come to fertility clinics clutching their straws, saying that they are so desperate to have the baby with their own eggs. We see them struggling. We would like to prevent such a thing happening in future for most of the patients. That's why we recommend this egg freezing as an insurance policy or plan B for people who are going to start the family at a later stage in life. What do we check in fertility is to see how you are doing. First of all, we will perform an ultrasound scan and a blood test to check the reproductive hormones. We also do semen analysis as far as the man is concerned, but of course today we are going to restrict our talk to the female fertility checkup. So we do the scan and blood test. In the scan, we look at your uterus and look for any fibroid or polyp which can interfere with you are getting pregnant. And we next look at the ovaries, the two ovaries on each side. Sorry, one ovary on each side, total two ovaries. We look at them right and left. And in the ovaries, look for any cyst or endometriosis again, which can cause problem. And last but not the least is the number of eggs in your ovaries. When I mentioned this to a lot of young girls, they don't even know. They said, oh, can you really do that? We never knew. So we look at the number of small follicles. Each one will have an immature egg inside. So we count the follicles. That will indirectly give us the number of eggs. That is what is called ovarian reserve. And we do the blood test. So we check the ovarian reserve by scan as well as by blood test. And the blood test is the hormone called AMH. Okay, next slide, please. Yeah, the AMH, anti-Mullerian hormone, gives us information about the egg count. And so we look at the scan as well as this blood test, and then we come to conclusion about the ovarian reserve. And we have the standard reserve, that is, average range is between 10 to 20 or 25. And we must sort of make sure it's all in that normal range. If it is below, then we say it is lower than expected for your age, and then you need to act. We also check other hormones because our checkup is a comprehensive one. If we don't do the basic stuff only, because it's important to know your body completely. There could be some other issues like thyroid functions, and your thyroid hormones can be low, or your vitamin D can also be low. These can interfere and make your cycles irregular and increase your risk of miscarriage. And similarly, the prolactin hormone, it is linked to the gonadotropins, the FSH and LH, and the GnRH release. Therefore, if the prolactin is high, it interferes with ovulation, cycles become irregular. That's the reason that we check all these hormones. If there is a high level of one of these or low level of this, it's better to correct them first. So we do that. So that is what is basically involved in the fertility checkup. Then once we do this test, we also take medical history to find out if there is anything relevant to this ovarian reserve or fertility potential in your case. And then we arrange a follow-up once we have all these results, and we discuss the results with you and tell you where you stand and what you should do. And we always discuss, look, we give you advice or recommendation, but we don't say you must do this. That is up to you as to what you should do or you would like to do. Then you make a decision, talk to your family, talk to your friends, and make a decision as to whether you should freeze the eggs or not. Sometimes if the AMH is low or ovarian reserve is low, people change their plans and start trying immediately instead of delaying the childbearing. Now, some women can ask me the question as to when should we freeze the eggs, or what are the conditions where you would recommend freezing the eggs? So if there is a family history of premature ovarian failure, then if the mother has this condition, then the daughter can have an early menopause as well. And therefore, it is important to take this into consideration, plan freezing the eggs before the mother went through menopause. And in some patients, when we do the checkup, if the ovarian reserve is very low, AMH level is less than 5, and the number of antral follicles is less than 4 to 6, then we think it's low ovarian reserve, because such women will go through menopause very early. Therefore, it's important to freeze some of the eggs for future use. And in other cases, like cancer patients who are going to undergo chemotherapy, we also recommend freezing before they start the chemotherapy so that they can use their eggs later on. And another condition, which I wouldn't say condition, another lifestyle thing which comes to my mind is smoking. Smokers have low number of eggs. Therefore, if someone is a chronic smoker for many years and you check the AMH, it will definitely be low. And on top of it, the quality of the egg will not be good. It will be very poor. And so if people are smoking, it's better to freeze eggs at a younger age so that your quality is better. And also you have not been smoking for so many years, then by the time we can freeze eggs for people who are smoking. And then we have patients who come at the age of 42 and say, oh, I have left it late, I haven't found Mr. Right. I want to freeze my eggs. I think that is rather late. We should do it when it is right. We recommend freezing eggs before the age of 36, that is ideally 35 or under 35, because that is the time when the egg quality is good. Over this age, the quality goes down and the number also goes down. So it is better to freeze. And later on, of course, then you might ask me, then why do you do such a thing? Because that lady has no other option. So we do it, but that's not the ideal thing to do. So can I have the next slide, please? Now I'm going to hand over to my colleague Samantha, who is an expert in egg freezing, and she will tell you the details about it.
Good evening. So when we egg freeze, okay, it takes approximately 2.5 weeks from starting a cycle to when we get to egg collection. And the cycle is very similar to undergoing an IVF cycle, and you would have to go an egg collection. We would then, when we thaw the eggs, we will need to do something called ICSI, which is intracytoplasmic sperm injection. So it's where we use a very fine glass pipette, about the size of a human hair in width, and we pick up a sperm individually and we inject it into the eggs. We have to do this because freezing eggs tends to harden the zona, which is, if you want, is like the outer membrane of the egg. And this allows us to put the sperm directly inside the cytoplasm and hopefully achieve fertilization. So the target number of eggs that we would suggest to achieve hopefully one pregnancy at the end of coming to thaw the eggs and to use them would be approximately 20 to 30 eggs. Now, this may take more than one cycle to achieve freezing that number of eggs, depending on how the patient responds to the drugs. Can I have the next slide, please, Severe? Okay, so egg freezing is usually a backup plan. It's usually a social egg freezing. So it would be suggested that everybody tries to achieve pregnancy naturally first. Okay, as with most assisted fertility treatments, there is no guarantee of a pregnancy when you use frozen eggs. And at the moment, under UK regulation, we're allowed to store eggs that are frozen for social reasons up to 10 years. And this can be extended to 55 years under certain circumstances. So if you were a person who was freezing your eggs prior to treatment for cancer, then you could be considered as having premature infertility, and you would probably be allowed to extend it after the 10 years. Okay, so the way that we freeze eggs, we use a technique called vitrification, which gives us greater survival rates. So when we freeze eggs using this technique, we have more than 90% of the eggs frozen survive the freeze-thaw process. Can I have the next slide, please? And I think this is where Severe takes over.
Thank you very much, Sam. That was very informative. It's just cold, hard facts about egg freezing. So I'm going to give you a bit more of the detail of what you might expect if you were to go through an egg freezing treatment. And as Sam mentioned, it's very similar to an IVF cycle. Essentially, what we're doing is we're splitting an IVF cycle into two parts. We pause it in the middle. So we will stimulate your ovaries to grow the follicles that Dr. Venkat talked about. We will then collect the follicles, we'll collect the eggs in those follicles rather, and then we'll freeze them. And then in due course, we'll come back to thaw them out and fertilize them and make embryos and hopefully achieve pregnancy, which Sam will tell you about, I'm sure, at another time. So what you can expect if you were to do this, really, as Dr. Venkat mentioned, you start with an initial consultation. We then do some tests and then arrange a follow-up consultation. That's considered our fertility checkup. That allows us to tell you about your fertility status and then potentially look at egg freezing if we think that's a good option to recommend in your case. If that's the case, we then arrange a nurse consultation where we go through the sort of regulatory stuff. We have to do some paperwork, so we complete the relevant consent forms. We will screen you for infectious diseases to make sure you're clear before we start. We'll also teach you how to use the medicines that you'll need to use for ovarian stimulation. So then you'll come to starting ovarian stimulation, which is making the follicles in your ovaries grow that are present that cycle. These are some injections. Everyone always has a lot of questions and concerns. How am I going to do injections? I'm needle phobic. It's not to worry. Our nurses are very well trained, and the injections are very fine needles that are built for patients to, they're designed for patients to self-administer. So it's very straightforward for us to teach you how to use this. We will then monitor you quite closely during this period of ovarian stimulation. So this lasts about 10 to 12 days from start to finish. We'll keep a close eye on you with ultrasound scans and blood tests to see how you're responding to the drugs that you're taking. Then when the follicles have reached a good size, the doctors will say, okay, it's time to get this patient ready for egg collection. We'll give you a final injection that makes the eggs in those follicles mature, and the eggs get released from the wall of the follicle, ready for collection. This is very similar to ovulation each month. Then we'll perform the egg collection. It's a fairly minor procedure. It's not an open surgery. There's not any significant risks from it. It takes about 20 minutes for us to perform, and we'll keep you in the clinic for a couple of hours after the procedure, just to make sure you recover well. And we'll ask you to take it easy for that day, but you'll be fine to return to your normal activities on the next day. And then, so on the day that we collect the eggs, we will rapidly strip the eggs and freeze them very quickly by this new method of vitrification. And then we'll keep them in liquid nitrogen for up to a period of 10 years. And as Sam mentioned, the time frame for this, so from, you need to do a checkup. It only takes us about a week to actually do the checkup, but it is cycle dependent. And similarly with treatment, you may be able to start with the next cycle, and from the start of your cycle to the egg collection, it takes about two weeks to 2.5 weeks, depending on how you respond. So it's a fairly straightforward process to go through. The drugs that we give you are your natural hormones that your body produces, but they're in a higher dose. And you shouldn't have any sort of significant side effects from the drugs, but they're hormones, so they might affect your mood to an extent, but nothing much to do with that. So I can just grab the next slide. So actually, at this point, I'm going to just open it up for any questions, and then I'll come back to the recap slide. So if anyone has any questions, please put them forward via the question and answer function on Zoom, or raise your hand if you want to speak your question up. But before we get there, Sam, I have a question for you. You mentioned a target number of, say, 30 eggs. Why? That seems like a lot of eggs to make one pregnancy.
So the reason that we say sort of 20 to 30 eggs is because only 20% of the eggs that are collected or that the body creates have the potential to achieve a viable pregnancy. So to achieve one pregnancy, 20 to 30 eggs would be the number that would be needed.
Okay, thank you. When you think about it, it sort of whittles down at every step. So
it does.
It seems, 30 eggs to make one baby sounds like a lot.
It does. And remember, every egg that's collected may not be suitable to freeze because we only freeze eggs that are mature.
And so what's the average sort of maturity rate if we just collect 10 eggs?
We would expect between 80 and 85% to be mature. So with 10 eggs, you'd expect 8 to be mature.
Okay, fair enough. And Dr. Venkat, I have a question for you. Why is it that we can only keep them for up to 10 years? Where's that number? Why is that the limit?
Well, it's an arbitrary number, actually. Historically, I can say that the Human Fertilization and Embryology Authority allowed the clinics to freeze the embryos for up to 5 years to start with. Samantha will yes, she's nodding her head. So
I will remember that. Yes, I remember it well.
Only 5 years. Again, that was an arbitrary number they chose, and then they were following it without any scientific research behind it. And then slowly they realized that it is not a problem, and they extended the storage. The embryos were not damaged, so they extended the storage of the embryos from 5 years to 10 years. So now we are allowed to store the embryos up to 10 years. And they just followed the same thing for the eggs as well, because they are similar things. We are doing similar procedure, and the HFEA is recommending that we keep the eggs frozen up to 10 years. However, now there are a lot of questions about it, because there are some young women, we tell the patients, it's better to freeze the eggs when under 30 years, when you're in your 20s, because that is the time when the eggs are of very good quality. And that is the prime of fertility. And we tell them to freeze. Supposing they can only keep it frozen up to 10 years, say if somebody freezes the eggs at 28, she can keep the eggs frozen only up to 38. And supposing she's not ready to start her family at that time, what will she do? She has to make a decision. So it becomes difficult. So the HFEA is having some consultations, and there are some requests from some women's bodies and other people to extend the storage period to up to 15 years. So they are considering it. So hopefully very soon the storage period can be extended to 15 years. And some women have this question: the longer we keep the eggs frozen, will there be more damage or deterioration of the quality of the eggs? No, it does not change. They are on ice. They just stay dormant. Whether it is 1 year, 10 years, 15 years, it is the same. The quality is not affected by the duration of freezing. Okay. Sudhir, now that you asked this, I was thinking, we talked about fertility checkup, freezing techniques and everything, and the treatment steps and all the risks involved, etc. One thing that we haven't covered is the sort of cost. I think it will be useful for the couple to give some idea, broad outline of the cost, because I think the egg freezing will be around 5,000 pounds. Is that right, Sudhir?
Yeah, that's about right. As a broad sort of picture, a checkup will cost you a few £100s. It costs anywhere from 300 to 500, depending on which clinic. So, for example, we offer a female fertility checkup that's quite comprehensive, that costs £400. And then a cycle of egg freezing will end up costing about 5,000, because the cycle fee itself is about 3.5, and the patient may need anywhere from 1,000 to 2,000 pounds worth of medicines, depending on her ovarian reserve and other fertility parameters. Yeah.
So that is a good thing. However,
and sorry, I was going to mention, we do offer, finance plans. So if you can't make a lump sum payment, you can pay it off in installments. So that often helps, because,
yes,
especially younger people tend not to have lumps of cash sitting around for this kind of thing.
Yeah. So that is, finance plan might be helpful. And there is another thing I think we should mention under these circumstances, because like young girls, we ask them to freeze the eggs around in their 20s. They won't have this 5,000, 6,000 pounds, but they can freeze their eggs free of cost, free of charge. There is another option. That is called egg sharing arrangement, in which, supposing we collect 20 eggs from the person. If that person has got no ethical objection or no moral objection or no emotional objection to sharing their eggs or donating half their eggs, 50% of their eggs, to another person who needs donor eggs, because there is a huge shortage of donor eggs these days. And if somebody is willing to do that, in return, you can freeze the eggs free of charge. And you will also get free medications which are used for the stimulation. So basically, that 5,000 pounds which is needed for the egg freezing treatment will be free for the person who is sharing the eggs. And all the women we say who freeze the eggs are under 35. They should be healthy. They should not be smokers and should not be having any chromosomal abnormalities or any other issues. And if they are willing to do that, they can freeze the eggs without any charge. However, they will have to pay for the storage of the eggs, which will be 25 pounds per month. I think these days there is a lot of issues with the jobs and other things. So this might be very useful, because the person is doing something very positive, giving back something to the community, and they're helping somebody who is in need of donor eggs. So which will be, I think, a good positive thing to do. At the same time, you get some benefit out of it as well.
Absolutely. I'm sorry we failed to sort of cover that in a bit more detail. I think it's a really good option because, as you said, you help yourself and you also help someone else with one treatment. So it's a fantastic option for younger patients who would like to potentially help someone else while also preserving their fertility for the future. So we do have a few questions that have come through, so I'm going to just triage them. This one's probably better for you, Dr. Venkat. Would you advise doing back-to-back cycles of egg freezing, or would you wait a month in the middle?
That's a good question and commonly asked question. When women have low ovarian reserve, like less than 10, that is the normal range, or even less than 5 is very low, we mentioned that the woman has to do more than one cycle to get 20 to 30 eggs, and in which case the time is also important. Therefore, we say they can do it back to back. And in fact, for cancer patients and somebody who has come from overseas, they can't wait 3 months. It's quite a long time. And there are scientific researchers and which recommend what is called dual stimulation. That is, you start the first stimulation from the menstrual period, that is second or third day of the period, we start the hormone injections. And by the middle of the cycle, if the stimulation is finished and we collect the eggs and freeze the eggs. And after 3 days again, we can start another set of stimulation. That is because there are still cohort of follicles in the ovaries, which can be stimulated. And then we collect the eggs when it comes to the period time. And after that period again, one can have another stimulation and finish. So we can do 3 cycles in 6 weeks. That is the very rapid back-to-back egg freezing cycle, or even IVF we do with the women with low AMH of cancer.
So
if you don't want to do that, you can do back-to-back with the period, like 3 cycles over 3 months. We can do that. There is no harm. But it is only for the women. I tell them, look, each person is different. And some women have the strength to go through it because your body goes through the hormone injections, and some women get stressed with these hormones and injections and doing all these things, coming to the scan so many times. This is a huge strain on them and stress for their emotions and everything. And if people can't do that, then it's good to have a break and then do it. My only worry is if the AMH is low, then it's not a good thing to delay this for a long time. Then the number will keep going down and down. So we have to get the balance right. Sorry. Yeah.
And does that mean, Dr. Venkat, that if you do your dual stimulation, does that affect the quality of the eggs on other cycles? So on the second cycle?
Correct. That's a good question, Sam. There are reports where people have done IVF with the dual stimulation for women with low AMH, and they found that the number of mature eggs and number fertilizing and number of blastocysts, which number of eggs or embryos which become blastocysts, and also euploid blastocysts, that is chromosomally normal blastocysts at the end, because that is the one which is going to give you a healthy baby. They found that there is not much difference or significant difference between the first half of the stimulation in a cycle and second half. We call it the follicular phase and luteal phase. And they found in the research that both have similar results. The quality of the eggs are not affected. Number of eggs are not affected. And blastocysts at the end, if we do IVF or ICSI afterwards, it is the same. So we have no worries about it. We can do it only if it is in indicated cases. Otherwise, then it is lot of, strain on the body. Women should have the strength to go through it because it's just one after another. That is the difficulty.
So to sort of summarize it in layman's terms, you'd say that it depends on the time pressure that the patient is facing. So if someone is about to, let's say you have your ideal candidate for egg freezing, someone who's 28 or 30. They have all the time in the world, their fertility is not, it's good, they've got 5 years left, before it even starts to decline. So in those cases, you would advise maybe taking a month gap just to let your body recover and make life easy for yourself and not stress yourself out. When the fertility sort of starts to decline, or you're worried about the ovarian reserve dropping, you might recommend doing back-to-back cycles. And then in the sort of more extreme cases where you've got a very low AMH or someone's about to undergo chemotherapy, you'd recommend this dual stimulation.
Dual stimulation, mostly in cancer cases, correct. That is the right thing.
Excellent, thank you. The next question we have is, I'm 38 years old. I'm not ready. I wish to get pregnant in maybe 3 or 4 years' time. Do you think it's a good idea for me to freeze my eggs?
Yes, without any doubt, not tomorrow, today, you should freeze the eggs, because time is of the essence here. Like I said, it's not only the number, it is also the quality goes down. And that is why we say, look, whatever you do in life, freeze some eggs for insurance policy, for plan B. And then later on, you can plan your life as to when to have children and other things. Without any doubt, I would recommend it strongly.
I have a follow-up question to that. If someone is in a stable relationship, or let's say they think they're going to be single, they don't really want to be with someone, would you recommend freezing eggs or embryos?
That is an excellent question, actually. If you are in a relationship, but you must be sure that you are going to be with that man, because you never know what is going to happen in life. That's difficult to predict. And therefore, I will say you can freeze one cycle of eggs, and then you do another cycle of stimulation, freeze embryos. Because the difference between egg freezing and embryo freezing is, with the eggs, you can use any sperm. Later on, if you are not with this man, you are going to be with another person, you can have a baby with the other new partner with using your eggs. Whereas if you have frozen the embryo, you can only have a baby with this partner. I think Samantha will be able to tell you the survival rate, difference in survival rate between the eggs and the embryos,
Yeah.
Sam, and success rate.
Exactly. So when you freeze embryos, using vitrification as well, 96% of embryos survive the freeze-thaw process. And depending on the person's age, it can be up to 65% in under 35s. 65% is the pregnancy rate you can get from transferring one blastocyst in somebody who's under 35 when they had the embryos created, so the eggs collected. Whereas with freezing eggs, the survival rate is only 90%. So I think what Dr. Venkat's suggesting is quite a good idea, to freeze some eggs and some embryos. Obviously, if you freeze embryos and the person providing the sperm is no longer your partner, they have the right to withdraw their consent from you using those embryos, I think is what Dr. Venkat is trying to say. So it can be a sensible choice maybe to freeze some of each.
Thank you very much. Next question is, once you have created embryos, how many is it better to transfer if they have been frozen? So I'm going to turn this to Sam, because I think it's a bit of a nuanced question.
It is a bit, isn't it? Okay, so success rates with frozen embryos, especially if they're frozen at the blastocyst stage, and probably for the past 10 years, if they've been using the vitrified embryos. So if you're using vitrified embryos, we would suggest that you only transfer one embryo at a time, because the success rate with blastocysts that are frozen is very high. And in fact, success rates with frozen embryo transfers can be higher than success rates with fresh embryos. Because it's to do with sometimes the drugs in a fresh IVF cycle can have a detrimental effect on the lining of the womb. Dr. Venkat, would you agree with that?
Absolutely correct. That's why they say that it's better to freeze the embryos. Now that is the trend in IVF. All the clinics, or most of the clinics, are trying to freeze the embryos and then transfer them in a subsequent cycle. This also allows them the opportunity to test the embryos, that is called pre-implantation genetic testing, so that if you have 3 embryos or 4 embryos, we know which embryo to transfer. We have to transfer the right embryo, especially if we are transferring one embryo, it has to be the right one, which will give you a healthy baby at the end. Not that you get pregnant and lose in the form of miscarriage. That's not what we want. We want you to go home with a healthy baby. Therefore, we say freeze the embryos. Before freezing, test the embryos. Choose the right one. Put it in next month. Go home happy.
You make it sound so easy.
It is.
So thank you for that question. I think in summary, we're saying if the embryos are of good quality, we would advise you to transfer one. But if perhaps you haven't been lucky so far, you've had failed cycles, or there's some other history behind it, or the embryos aren't of that great quality, then we may look at transferring two.
And also, Suvir, when someone is of higher age group, like 40 years, they think it's better to have 2 embryos to increase the chances, because the implanting capacity of the 40-year-old egg is much lower than a 30-year-old. That is
So a lot depends on the quality of the gametes that we use to create the embryo, the quality of the embryo as well.
But you wouldn't suggest having 2 put back at 40 if you'd had them PGT tested, would you?
No,
You'd only then suggest one.
Not first attempt, correct.
Exactly.
And, yes, if they have had a few failed cycles, because Sam will just support me on that. In our clinic, we get a lot of people who had unsuccessful cycles in other clinics, and then they come to us thinking that we can make magic, but then becomes more challenging. So in such cases, I will say we can recommend 2 embryos, and especially if they are over 40, just to increase their chances or maximize their chances.
Yeah.
Next question.
So,
sorry, go on.
I was going to say, so it's really dependent on the person and their medical history.
Absolutely. The next question we have, and I think we might really need some miracles. I have just 2 eggs frozen. Is there any possibility that I can get pregnant? And I'm going to ask
what age was it frozen?
If possible, could we get your age from the person who asked that question?
Or the age when the eggs were frozen.
Your age when the eggs were frozen. But as a broad stroke, would both of you please take it in turn to try and answer this question?
Well, 2 eggs, I do not know honestly, I do not know the answer.
So she was, sorry, she's given the age, she's 39.
When the eggs
she was 39 when she froze the eggs.
Yes, okay. I mean, it depends now when we take out the eggs, that is warm the eggs, and depends on how many survive and how many fertilize with ICSI, and then how many become blastocysts, and how many are chromosomally normal, because the age factor comes into play, and it depends on all those factors. If everything goes well, then there is a chance that you can end up with a baby. But if things are sort of, you don't have 2 embryos, you have 1 embryo, if it stops dividing, it stops growing, that is, we call it arrest, then the chances are lower. If the eggs and the embryos behave as they are supposed to do, then it can happen. I wouldn't say no, but the chances are not that high. Sam, what's your view?
I think if they're the only eggs that you've got, then everything has a possibility to work, and I think you would obviously want to use those eggs. The possibility of walking away with the pregnancy, I think, is very dependent on how they fertilize and how they grow and how they develop. I mean, the possibility is there, but I think it's quite a small possibility with that number of eggs.
So in such cases, would you, and you touched upon this earlier, both of you, which is that it really should be a plan B or an insurance policy. So, I presume this lady is now a bit older than she was when she froze the eggs. Would you still advise them to sort of try naturally, or even look at maybe trying an IVF cycle before using those frozen eggs?
Yes, because if they did an IVF cycle, they could always thaw the eggs on the day when the lady has the egg collection, and therefore you could perform the ICSI on the frozen eggs at the same time, so you could supplement them with fresh eggs from a fresh cycle at the same time. It depends on the age of the lady, I suppose. But
yeah, but
that would be a possibility.
Presumably she hasn't gone through menopause.
Exactly. So that would be a good possibility, because you would have more eggs, and hopefully therefore more fertilizer, more embryos to either grow to blastocysts and PGT test, or replace, or all of the above.
Dr. Venkat, how would you feel?
Yeah, it depends on the age of the woman right now, because she froze at the age of 39 and she could get 2 eggs to be frozen. That means, that shows that her ovarian reserve was low at that age. That means, supposing she's now 2 years older than that, that is 41, if she still has some eggs, it's worth trying. Naturally, in fact, under these circumstances, natural trying is the best, but if it doesn't happen, they can go for IVF and other treatments. But if there is a long gap between the egg freezing and the current date, then probably there may not be many eggs or many good quality eggs, because we have to look at the quality. That is more important. If, some ways, say she froze it at 39, if the woman is now 45, the story is different, because do we have any eggs? And if we have, what is the quality of the eggs? And those are the questions which we have to answer. If she doesn't have eggs, then obviously it's worth using these eggs, because there is no other option. This is the only way she can have a baby with her DNA.
Okay, thank you very much. She's given us a bit of a follow-up. This almost feels like a thriller. You get it piece by piece to see if you get it right. So she says, I got pregnant naturally after the egg collection. I'm 2 months pregnant now, in my 40s. And since I have these 2 eggs frozen, I would like to try in the future. So I assume that it's worth a try.
Yes,
definitely.
Yeah. So,
and she's got that is the right thing. Now she's pregnant, 2 months pregnant. We hope everything goes well. So basically, she can use the eggs for the second baby or future pregnancy. That is the best thing.
So we wish you all the best and congratulations on being pregnant. The next question that we have is, if 3 eggs are collected on your first cycle of egg freezing, how do you increase the chance of increasing the number of eggs collected in another cycle? Because 30 seems like a tall order.
Okay. First of all, there are a few things, we have to check here. Did we use a small dose to start with? And that is why only 3 eggs were produced, in which case we have the option of using a higher dose to increase the number of eggs which grow, and we will be able to get more eggs. That is one way of increasing the number of eggs we get. But ultimately, if the ovarian reserve is low, with low AMH and low number of antral follicles, then this may not prove very helpful. In which case, what we would suggest is taking some supplements, which is supposed to be helpful, such as DHEA, that is Fertility, which can bring more eggs to the surface of the ovary. Because people can ask me this question, I want to make it clear. Women are born with eggs, and they lose eggs during their reproductive age period and time. And once they sort of complete the stock, use all this number of eggs they have, or use the stock of eggs. They run out of eggs and they go through menopause at that stage. And if we say that women are born with eggs, and on the other side, I'm saying, take this medication, it will increase the number of eggs. You are not going to produce more eggs with the DHEA. What will happen is from the pool inside the ovaries, a few more eggs or the small antral follicles will come to the surface. So when you are going through the stimulation for egg freezing or IVF, that woman is likely to produce more eggs. That is the answer to your question, to say that this is one way of increasing the number of eggs you produce in the next cycle. You can take DHEA and coenzyme Q10, 200 milligrams 3 times daily. And some people say, again, human growth hormone is also helpful to increase the number of eggs. These are all, but some of them, like growth hormone, is very expensive. It may not be helpful in everyone. It may be helpful in some women, but we have to check that. And again, DHEA and CoQ10 is helpful in some women, particularly younger women with low AMH. They respond better to the DHEA and CoQ10. Whereas if it is due to the age factor, then it becomes rather irreversible.
Thank you very much for that helpful response. And actually, if you want some more information on this, we did a webinar, I think 2 or 3 months ago, on fertility and nutraceuticals or supplements that might help improve the number of eggs that are produced. So you may wish to take a look at that recording that's available on our website. So that brings us nicely to allow me to wrap up. So I'd like to just sort of summarize this evening's talk. I'd like to say that we advise everyone to think about their fertility, maybe get a checkup to monitor what's going on. Think about the future. If egg freezing is a good option, then it's something worth exploring. Please talk to us. We're here to help you if you have any questions or doubts. We have a new patient coordinator whose name is Karina. If you haven't been to the clinic before, please contact her via email or our website or phone. She'll be happy to answer any questions that you might have. And our next webinar in this series is going to be on gynecological issues relating to fertility. That's on the 17th of September at 7:30 in the evening. And all that remains is for me to thank our panel for their time and effort on this. So Dr. Venkat, thank you very much. Sam, thank you very much. And I'd like to thank the audience. I hope that this was an informative presentation. And I wish you all a very good evening and a lovely weekend. Take care.
Thank you.
Thank you. Bye now.